Part 3, bone fractures and homeostatic imbalances. So there's different classifications that we have for bone fractures. One of them can be based on the position of the bone ends after the fracture. So displaced means that the bone ends are no longer in alignment, while non-displaced are when the bone ends are still in alignment. So here you can see that the end broke and they're not aligned anymore, while over here you can see that the bone is still in alignment. The completeness of the break, complete versus incomplete. So if it broke all the way through, then it's a complete break, and if it didn't, it would be considered incomplete. The orientation of the break to the long axis of the bone. Linear breaks along a linear angle, while transverse cuts straight across, or perpendicular to the bone. Whether or not the bone ends penetrate the skin, a compound or open fracture penetrates through the skin. In this situation, as you can see how horrible that looks, but in this situation there's a high risk for infection. Simple or closed means that the skin was not broken, so the risk of infection is significantly lower. And then there's some common types of fractures. So a comminuted fracture is when the bone fragments into 3 or more pieces. A compression fracture is when a bone is crushed. A spiral is when a bone is broken in a spiral shape, and that usually occurs when there's excessive twisting forces. An epiphyseal is a break along that epiphyseal line. If it happens along the epiphyseal plate or the growth plate while the bone is still growing, it may affect the bone growth. Depressed is when a bone is broken inward. So here you can see a depressed fracture in the skull. And a green stick, that's when the bone breaks incompletely, and these broken ends are kind of like if you were to ever take a fresh twig off of a tree and try to break it, you see the green part in there because it's still a living branch. That's kind of how this is described. So it's still tightly held together, but it's flexible. So what happens after a bone breaks? Well, the first thing that's going to happen is you're going to have these blood vessels break. And blood is going to fill up the spaces between the broken bones, as well as all of the space underneath that periosteum. Then what's going to happen is a hematoma, or a blood clot, is going to form. So all of that blood is going to clot. Eventually, that clot is going to turn into a fibrocartilaginous callus. The fibrocartilage is replaced by bone, and it's going to be all spongy bones straight throughout the entire break, and even underneath the periosteum. And then eventually you'll have bone remodeling, where the outer edges of the bone become compact again, and the inside of the bone becomes spongy, and the bone starts to take on a more normal shape. So what are some of the homeostatic imbalances associated with the skeletal system? Here we have Osteomalacia and Rickets. In both of these diseases, the calcium salts are not deposited, so for whatever reason they're not deposited. Usually it's due to a vitamin D deficiency or not enough dietary calcium. Rickets is a childhood disease, while osteomalacia happens later on in life. And with rickets, it causes bowed legs and other bone deformities. So here you can see rickets and how bowed the legs are here. Now it's important to make note of the fact that babies are born with bowed legs. So typically babies' legs don't straighten out until they're about a year, or maybe even 2 to 3 years of age. And that's because when they're in the womb and developing in utero, their legs are all squinched up. So however the baby's positioned as they're developing inside of the uterus, that's going to change the shape of their legs. So we're not talking about that. We're talking about a severe bowing of these bones, and the cause is a vitamin D deficiency or deficiency in dietary calcium. So this is actually a medical condition, not something that the child would grow out of easily. Osteoporosis. So that's when the spongy bone becomes really porous and you have a loss of bone mass. So the spongy bone, particularly of the spine, so of your vertebrae, and the neck of the femur become most susceptible to fracture. This is more common in postmenopausal women. So risk factors include being a postmenopausal woman, basically. As soon as you stop producing estrogen after menopause, you are going to lose that hormone that directs bone deposit. And that's only one of the hormones that does this, but it's a big hormone that's going to cause a decrease in bone mass. Fitness is really good in preventing osteoporosis. So if you continue to walk and do light exercise and stretching and light weightlifting type activities as you age, it's going to decrease the likelihood that you're going to develop osteoporosis. Why? Well, if you don't use it, you lose it. So if you are taking on a stagnant life in older age, then you're not really using those parts anymore, and they will be encouraged to kind of waste away. But if you're actively using it, putting pressure on those bones, then the bones are going to be encouraged to continue their bone deposit through other means besides just the estrogen. A lot of times you'll see women develop a hump on their back. So their neck actually starts to have these little fractures that form, and they start to slouch. They may even decrease in size a little bit. Paget's disease. Paget's disease involves the excessive and haphazard bone formation and breakdown. So here you can see what a normal tibia looks like, and then over here you can see Paget's disease and what Paget's disease does to a bone. Pagetic bone is very high ratio of spongy bone to compact bone and reduced mineralization. We don't know what causes it yet, potentially due to a viral infection. The treatment includes calcitonin, which, remember, that's a hormone that's naturally produced by the thyroid, but we supplement it in excess, and then biphosphonates. This region is extremely painful, so patients' number one complaint is pain with that pagetic region. And then osteomyelitis. Itis is talking about inflammation. Osteomyelitis is a bacterial infection of the bone and the marrow tissue, so the red marrow and yellow marrow. It's commonly caused by staph species, and symptoms of osteomyelitis include heat, swelling, and pain around the infected bone region. To treat this, you need aggressive antibiotic therapy. The prognosis, it may lead to the death of the bone, which may result in amputation. You may have to have regions of the bone cut out due to the death of the bone. And how this happens, this can happen just in old age. Bacteria can start to spill over into the bloodstream. Sometimes a patient has endocarditis. Now you've got bacteria in the blood. It dislodges from the heart valves and ends up in the joints or ends up in the bones. Anywhere it can cause this type of infection. And then much more commonly, if you have an open fracture that opens up to the outside of the body, then you can get an infected bone.